on the web, and in your hands. This is MDiTV.
Gary McFay is mechanically inclined, which comes in handy since he depends on a machine to get some of the treatment for what doctors believe was a serious staph infection. The machine is an infusion pump. Millions of people rely on them to manage their medications. They almost always work well, and for many patients, infusion pumps mean getting back home sooner. But each year, about 100 people in the U.S. die because something went wrong with an infusion pump or how it was programmed. As part of a new initiative, the Federal Food and Drug Administration issued infusion pump risk reduction strategies for patients using infusion pumps at home. The advice on the agency website and in brochures includes a checklist of common sense yet vital steps, including these from Dr. Jeffrey Shuren, who directs the FDA Center for Devices and Radiological Health.
If you're going to be using an infusion pump in the home, make sure whoever is giving you that pump, if it's the visiting nurse, if it's a home health agency, to sit down with them and talk to them with that device. Make sure you understand how to use it properly, what can go wrong and what to do if something goes wrong before that person leaves, so you understand. Make sure you've got a backup plan if that device fails. If a battery can run out, you're going to need a backup battery.
Gary McFay agrees that the battery system of his infusion pump could be improved.
The only thing that I see that could be changed possibly on it to make it even easier is if you didn't have to change the battery every time you change the bag that runs the pump. Now, if it had a built-in lithium battery that, would stay charged for, say 2 weeks at a time or a week at a time, or, once a week you go sit down in your chair after you've changed your bag, you plug it in and to a charger, and in an hour it goes beep and says you're fully charged and you're off and running for another 2 weeks or whatever.
Home health nurse Mary McMahon visits McFay once a week. She sees design issues that can create challenges for some patients.
If there was a way that we didn't have to have them go through the system of having to reset a new volume, where all they had to do was change the bag and press start, and then I have my patients look through the program as well to make sure that it still says this is your volume, this is how much you're getting every 4 hours. My patients will do that. If we didn't have to do the reset volume, that's where I tend to see more of the problems, or changing the battery.
There's that battery issue again. While patients who are comfortable with technology like Gary McFay quickly pick up the key points of operating and maintaining a home infusion pump, others don't. Jeffrey Lerner is the president of an institute that evaluates medical devices.
People are generally not comfortable with a lot of sophisticated technology. Mm-hmm. And a lot of people are ill, so they're not particularly well prepared, they themselves. Mm-hmm. Their caregiver, if it's a relative, may also be pretty tense. And you also have situations where you have an older population now, maybe people who are less comfortable with some of the computerized technology that's in smart pumps.
The hospital models are more complex than home infusion pumps and may challenge even trained professionals.
So in using the pump, troubleshooting the pump and learning all the tricks to make it work well is probably the things you learn from other nurses. So your pump will just be beeping and beeping and beeping, and you don't know that you've got air in the cartridge and that's why it's not working. So another nurse will come in and show you how to strip that air out or drain it differently to get that air out. And there's no instructions that show you how to do that. It's just tricks that you learn.
The new FDA initiative on infusion pumps is intended to minimize the risk of pump failures or operational errors. We have more details on that shift in FDA policy in our other MDiTV video report on infusion pumps. To get a link to the FDA's guidance for home infusion pump users, click on the Read Article button next to this video on the MDiTV site. I'm Andrew Holtz, MDiTV News.